So now it's time for Shiri's oral mech exam. An oral mech exam is just completed to assess strength and range of motion and agility. It also assesses oral symmetry, oral hygiene, her gag reflex response, cranial nerve functions, and also velar elevation on phonation. In this case, it should also focus on the head and neck musculature for swallowing to assess cranial nerve function. So here I have my barrier, my gloves, a tongue depressor, and then I'm using my phone as a flashlight. I will be assessing the appearance and symmetry, strength, range of motion, and rapid alternating movements of different areas. So we're going to start with the face. So the first thing I'm going to look at is the symmetry, and everything looks very symmetrical. And eye drooping is not noted. I will now look and assess the facial muscles and the muscles of mastication. So observations may be made at rest and during tasks such as lip pursing and smiling for cranial nerve 7. I'm going to have her keep her lips pursed as I attempt to separate them. Okay, so I'm going to pull down. Good. I'm going to pull down here. Good. On the side. Good. To assess the muscles of mastication, I'm going to have her open and close her mandible or her jaw. So open and close, open again, and close again. Good. I'm noting the strength of her mandible. I will also have her bite down while I feel for palpation of the masseter muscles on the sides of her face. So you're going to bite down. Very good. Now I will assess for trismus, which is a restriction of the jaw opening. So she's just going to open her mouth as wide as possible. Very nice. And I'm going to assess the lateral movements by having her move her jaw back and forth. Very good. Okay, now we're going to look at her lips. So I will have her protrude or purse her lips and then retract or smile. So you're going to purse your lips and now smile. Very nice. So they were symmetrical and they move evenly. Now I will assess strength by having you purse your lips and keeping them together tightly, which I already did actually, so we're not going to do that again. But I will assess her rapid alternating movements by having her say pa pa pa.
Pa pa pa.
Okay, so you're going to say that for about 5 seconds. Ready?
Okay. Pa 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 pa.
Good. So I was just taking note of the coordination rate and accuracy of her rapid alternating movements. So now we're going to look at her tongue musculature. And we're going to assess for integrity, and I'm going to have her stick out her tongue and move it to the sides. So stick it out as far as you can, and now move it from side to side. Very good. And then I will also have you elevate your tongue, the tip of your tongue to the roof of your mouth, and say ta.
Ta.
Very good. And now I will have you stick your tongue out against resistance. So I'm going to use my tongue depressor. I'm going to put it sideways, and you're going to stick your tongue out against resistance. Very good. Strong tongue.
Thank you.
Oh, you're welcome. Now I will inspect the tongue for any atrophy or fasciculation. So you're going to stick your tongue out for me. I'm going to use my flashlight. Everything looks good. And I was also inspecting the tongue for any structural changes like resection. Okay, now I'm going to look at your oral cavity. I'm looking for lesions, thrush, and the saliva flow. I'm also taking note of any xerostomia or dry mouth and any unusually thick secretions. And I'm going to look at your teeth. So you're going to open up. Everything looks good. No bite marks on the sides of your cheeks. Very nice. She didn't have any missing or broken teeth, and she didn't have any ill-fitting dentures because she's not wearing any dentures. I looked at her gums and the color, and everything looked normal. Now we're going to do the velum at rest and in phonation. So I'm going to use the tongue depressor again, and I'm going to test for your gag reflex. So you're going to open your mouth up. Are you nervous? Okay. Okay, a little bit, and let's try the other side. Yep, and there it was. So the velum should move bilaterally, which it did. However, the presence of a gag reflex is not necessarily an indication for a normal swallow response because many normal swallows do not have a gag reflex. So the absence of a gag reflex may not be important for the consideration of dysphagia, but she did have one, so we know that that cranial nerve is working. In relation to the pharynx, there aren't any tests that specifically test pharyngeal function that can easily be appreciated during a clinical swallow exam. But in some patients, activity of the superior pharyngeal constrictor can be observed after an active gag reflex or during the production of a falsetto voice. So we're just going to have Shiri produce a falsetto voice if she can. Do you know what that is?
High voice.
Yep. And I'm going to look in while you do it.
I know, I sing for a living.
All right, very good. And last but not least, I'm going to take a look at your larynx.
Okay.
I'm going to assess both the intrinsic and extrinsic musculature of the swallow. So I'm going to have you phonate while I listen to the vocal quality. I'm going to take note of any hoarseness or breathiness or wet gurgling quality. So you're just going to say, Sounds pretty normal to me. I'm also going to have you complete a dry swallow while I put my 3 fingers right here and check for elevation. Very good. So it moved up. So we are all done with the oral mech exam.